We are about 2 months out from a decompression of the common peroneal nerve at the fibular head, which is still early in its healing, but nicely healed, as well as a release of the superficial peroneal nerve in the lower leg. And this patient had about 6 months of a significant foot drop where she was barely able to overcome gravity at all, just a flicker of motion in the foot, which began fairly quickly after she was rehabbing her right leg, totally unrelated. And she was seen by a spine team first, and they made a very astute observation that it was not her spine. So we're going to give a kudos to nurse practitioner Wilt, Carol Wilt, and Dr. Fetter over at St. Joe's, who diagnosed her with a common peroneal nerve compression at the knee, which caused her inability to lift her foot, as opposed to a herniated disc in her spine that may cause that. So they did a great job on that, and they sent her over to see us. And she was barely able to move her foot, and this is only 2 months out from surgery. Show us what you can do with your foot over there now. And move to the outside and prick your big toes up, or toes up, I should say. Now, how was that before? I realize we didn't probably take an image before this, but how were you able to do that compared to 2 months ago?
Oh my gosh, it's like 100% improvement. I couldn't wiggle my toes at all. I could only point down. Now I can not only lift my toes, but I can actually lift the ankle as well.
And exactly, everyone is different, but how long did it take you to notice that your foot was improving after we decompressed that nerve?
I say within the first week, I definitely noticed.
Yeah, so you were very fortunate that your compression was caught fairly early. The nerve was still intact. It hadn't been progressed for a very long time, and the nerve wasn't torn in half by an injury of any sort, but it was just tight and strangulated, and so your nerve was able to come back pretty quickly. Now tell us about numbness, tingling, and buzzing and burning. Were you having those symptoms too?
Yes, I was having all of those symptoms, the numbness, tingling, the weakness and everything prior to the decompression surgery. I noticed within the week after surgery, numbness and tingling was starting to decrease. Definitely regained motion. Was able to wiggle all the toes pretty well within the week after surgery, and also was able to get started to get some ankle flexion going.
So one of the things that we use to determine if a person may have a compression here, while it's not 100%, the patient had what's called a Tinel sign, which is a funny bones feeling when you hit your elbow and it rains into your finger. That's a funny bone. If you hit here, the patient had a lot of tingling down into the foot, as well as an EMG nerve conduction study was relatively helpful. But she also had the same thing right here where the superficial peroneal nerve comes out. And so this nerve was pinched here and a second pinch down here, causing the weakness in the ability to lift up and out, and also potentially the numbness. This one is a sensory branch and only causes numbness, tingling, and burning. And this used to go to the top of her foot. How does that feel now?
Oh, it feels pretty good.
That feels pretty normal?
Yeah, it feels pretty normal now.
All right. So would you consider this relatively successful?
Yes.
All right. Very good. Thank you.